This is an Emergency Medicine Resident Student Association presentation on the Board Certified Emergency Medicine Physician. The RSA seeks to educate our residents and medical students today in order to make educated decisions tomorrow. So what is a Board Certified Emergency Medicine Physician? A specialist in emergency medicine is a physician who has achieved, through personal dedication and sacrifice, certification by either the American Board of Emergency Medicine, ABEM, or the American Osteopathic Board of Emergency Medicine, AOBEM. Who is the American Board of Emergency Medicine? The ABEM is one of 24 medical specialty certification boards recognized by the American Board of Medical Specialties. The ABEM mission is to ensure the highest standards in the specialty of emergency medicine. Becoming board certified requires completion of an emergency medicine residency training program accredited by the Accreditation Council for Graduate Medical Education, ACGME, or the Royal College of Physicians and Surgeons of Canada, RCPSC. There are essentially 3 steps for physicians to achieve certification in emergency medicine after completing residency training. Step 1 is to apply for certification and receive ABEM approval after meeting credentialing requirements for certification in emergency medicine. Step 2 is to pass the Aem Qualifying Examination, which consists of 305 multiple choice questions over an 8-hour session. Test material is derived from the model of the clinical practice of emergency medicine. Step 3 is to pass the ABEM Oral Certification Examination. This exam uses the e-oral exam setting, which displays ultrasounds, labs, vital signs, and a rhythm strip that goes along with the oral questioning from the examiner. The process of registering for and taking the ABEM board exams begins months before receiving certification. Candidates are assigned to either the spring or fall oral exam dates after completion of the written portion. Costs range from $1,380 to $3,260, depending on certain late fees. Why should this be required? Well, there are many obvious dangers in the hiring of non-board certified physicians. Board certification is a requirement of all specialties. Allowing a pathologist to practice emergency medicine is just about as safe as allowing an emergency physician to act as a pathologist. Hint, not safe at all. Emergency medicine is a life and death field. Requiring residency training and certifying exams ensures a minimum competency of emergency physicians. Allowing those without proper education and certification to practice emergency medicine will be a detriment to patient safety and the medical specialty in general, stymieing the evolution of emergency medicine and turning it into a backup career. Those who properly trained with years of experience and sacrifice would lose jobs and have pay diminished if those without proper education and certification were allowed to practice. The American Academy of Emergency Medicine and the AAEM Resident and Student Association were created to ensure that practicing emergency physicians are residency trained and board certified. Promoting the importance of board certification in emergency medicine is one of AAEM's founding principles. AAEM is committed to fighting the disturbing trend in emergency medicine today, which attempts to diminish the value of board certification. The AAEM has had activity in ensuring proper board certification since the association's inception in 1993. That's 24 years of advocating for patients, physicians, and the specialty of emergency medicine. Thanks for listening, and for more information about board certification, visit the ABEM and AAEM websites.